Dancers start the movement by flexing the spine laterally, using their erector spinae. At the same time, they are abducting the right arm in the frontal plane, contracting the deltoid and trapezius concentrically. Next, the biceps brachii, brachialis, brachioradialis are contracting eccentrically. All other muscles are being held isometrically to maintain the posture. Giving way to gravity, the deltoid contracts eccentrically, releasing the arm downward. Our spine then flexes forward and our rectus abdominis, external and internal obliques contract. The upper, middle, and lower trapezius, the levator scapula, and the rhomboids work to adduct the scapula horizontally as the arms are adducting into the transverse plane of motion. As the skull flips upward, the splenius and the spinalis cervicis extends, and the flexion of the sternocleidomastoid takes place. During rotation at the atlantoaxial joint, the longissimus capitis aids in same-side rotation. The sternocleidomastoid aids with rotation to the opposite side. We return to a vertical position by the extension of our erector spinae. Our arms adduct into the transverse plane, and biceps brachii contract isometrically in the transverse plane. The serratus anterior abducts the scapula, and the hands are supine. The arms circumduct back to anatomical position. The elbow flexes, and the biceps brachii, brachialis, and brachioradialis are contracted isometrically. As we lift our arms upward, the deltoid contracts, and the trapezius muscles and the pectoralis minor keep the scapula pulled downward. Rotating side to side, the rotators and multifidus muscles are working in oppositional rotation of the spine. The longissimus thoracis and iliocostalis thoracis work on same-side rotation of the spine. In the abdominals, the external obliques work in opposition to the direction of the rotation, and the internal obliques work in the same direction as the rotation. The spine extends with the transverse abdominis as a stabilizer. Our arms and scapula adduct. The levitator scapula, rhomboids, and pectoralis minor aid in scapular rotation downward. The spine extends.